Today I'm reacting to 5 fascinating body modifications. As an orthopedic surgeon, modifying bodies is a very big part of what I do. Although typically, the modifications I perform repair injury or restore functional deficits, as I strive to help my patients move efficiently through the world without altering their appearance in any noticeable way. Take an ACL reconstruction, for example. The anterior cruciate ligament inside the knee may be completely replaced, but if the surgery goes as planned, it can be difficult to tell it even occurred. But today, curiosity got the better of me, and I decided to take a look at body modification undertaken in order to alter physical appearance, and the reasons why a person may be compelled to undergo these procedures. One of the most intuitive reasons to undergo body modification is to be unique. An interesting 2021 study in the Public Library of Sciences journal attempted to find the link between a person's need for uniqueness and their body modifications.
Unique New York. Unique New York.
Researchers found a significantly higher expression of need for uniqueness, or NFU, among tattooed individuals than non-tattooed individuals, with individuals showing a high NFU being more likely to have their bodies modified than those without. The thing is, as body modification becomes more mainstream, the need for uniqueness relative to other people remains the same, pushing people towards more and more radical body mods. So while there are many types of body modifications that have little to no risk, most piercings and tattoos, they don't stand out as much as, say...
Ooh, that's a needle going into my head.
Take the bagel head procedure. Born in 1999 at a place called ModCon in Tokyo, Japan, wherein a professional piercer administers several hundred milliliters of saline underneath the skin in the forehead.
Kind of tingly and also kind of a building pressure that's kind of slow and steady that feels like it's putting me to sleep.
Normally, saline injections are used to restore lost water and salt in your body and as an additive for total parenteral nutrition, intravenous administration of nutrition, and other IV fluids.
Drip intravenous.
Too much saline can result in fluid overload, swelling, acidosis, high blood sodium, and in those with long-standing low blood sodium, it could lead to osmotic demyelination syndrome, which causes brain cell dysfunction. Not good. Fortunately for aspiring bagel heads, most of these things can be treated fairly simply.
The finish of the bagel head process.
This thumb is digging into my brain. Sweet, buttery bagels. I'm impressed.
The effect is only temporary, as saline is absorbed or urinated out in 6 to 24 hours. And while the procedure may cause a stinging sensation or a headache, and some bagel heads develop a skin infection after the fact, it's a walk in the park compared to some of the body mods to come. When the need for uniqueness compels a person to undergo surgical intervention, the stakes are much higher. Whether a form of amputation or structural alteration, as pictured here with the black alien, surgery and anesthesia are inherently dangerous, and there is always a chance that something can go wrong, such as blood clotting, hemorrhage, or nerve damage. Coincidentally, the Black Alien Project Instagram account was recently shut down due to apparent guideline violations. Shout out to PK Chronicles YouTube channel for collecting these images before that happened. On his Instagram page, the Black Alien spoke openly about his process and shared plans for future surgeries, including the foot structural alteration you just saw, which can actually occur naturally in a condition called ectrodactyly, and even removing one of his legs from the knee down, replacing it with a prosthetic. I think I can see how Instagram may have interpreted his posts as a glamorization of dangerous procedures, and perhaps that's why they disabled his account.
Got him. We fucking got him.
To me, surgery is a last line of defense to restore health and well-being, only after all other options have been attempted. If we assume that the Black Alien, or similarly severe body modders, undergo surgery to satisfy a need for uniqueness, the risk may outweigh the reward as their health is directly in jeopardy. But it may be possible that the Black Alien and others seeking extreme modifications are attempting to restore their health and well-being in a more fundamental way.
Chloe Jennings-White spends her days confined to a wheelchair. It's tough to get around, and she struggles with living in a world that isn't built for the disabled.
Have you ever heard of body integrity identity disorder, or BIID?
Chloe is actually able to walk perfectly and chooses to live her life like a paraplegic due to a rare psychological disorder, BIID.
Body integrity identity disorder is a rare condition in which there is a mismatch between the mental body image and the physical body. Those with the condition feel a discomfort in being able-bodied, with a desire to remove limbs, blind, or even paralyze themselves to regain a sense of self.
I have fantasies about having a car wreck and becoming paraplegic from a car wreck.
Some of these people mutilate themselves, others ask surgeons for an amputation or even for transection of their spinal cord.
BIID has led Chloe, a Cambridge University educated research scientist, to harm herself in a bid to become paraplegic.
Yes, they purposely try to become paraplegic. If your mental body image is paraplegic, there is no gentle way to go about creating that change. For a person with BIID, seeking surgery may be the only way to feel like themselves. With this information in mind, perhaps the extreme body modification like those undertaken by Human Satan or the Black Alien Project are attempts to realign their mental and physical body image.
Perhaps most shockingly of all, London-born Chloe is on a quest to find a surgeon willing to operate in order to paralyze her legs forever.
As a practicing surgeon, this sort of request would be very conflicting, and in the end, I would decline.
No.
I'm sure, like Chloe, the Black Alien and Human Satan have had difficulty finding surgeons to undertake their more extreme procedures.
I said no.
An interesting article in the American Journal of Bioethics considers the controversy about elective amputations of healthy limbs. On the one hand, the principle of autonomy is used to deduce the right for body modifications. On the other hand, the autonomy of BIID patients is doubted. The article goes on to explain. Neurological results suggest that BIID is a brain disorder producing a disruption of the body image, for which parallels for stroke patients are known. If BIID were a neuropsychological disturbance, which includes missing insight into the illness and a specific lack of autonomy, then amputations would be contraindicated and must be evaluated as bodily injuries of mentally disordered patients. Thus, according to this view, the desire for amputation or extreme body modifications would be considered a symptom of an underlying psychological issue. And instead of only curing the symptom, a causal therapy should be developed to integrate the alien limb into the body image. Sounds reasonable. But if we extrapolate this reasoning to apply to our body modification enthusiasts, we'd be reprogramming them to integrate a body image that is more normal.
Well, what is normal? Is there even such thing as normal?
But then, who decides what normal is?
You tattoo your face, you're essentially saying, hey world, I'm gonna go ahead and exchange any and all possibilities of normal human interaction for the gift of instilling paralyzing fear in anyone that looks in my direction.
The Black Alien, also known as Anthony Lofredo, explains his conflicted relationship with his body.
Yo lo amo porque es mi cuerpo. Y al lado yo lo odio porque también no es el cuerpo que yo quiero.
So, if Anthony's desired body image is that of the Black Alien, should he be coerced to believe that it isn't?
Es como una pelea juntos.
Does he need therapy to integrate human limbs into his alien image? Obviously, we're not talking about severing his spinal cord as we did with Chloe. Just a few fingers and a leg. Where do we draw the line? Anthony makes it clear that his natural and healthy human body is not the body he desires. He sees himself as the Black Alien, to him a form of artistic expression, and much of his energy is devoted to making this change a reality.
Es como un programa en mi cabeza.
Ocupa todo.
Todo. Siempre en mi cabeza.
He goes on to say that the only time he feels strange is when people look at him funny in the street.
Me siempre lo mismo. En la calle me siento un poco raro.
Claro, no puedes.
Porque la gente me mira demasiado.
Only then does he step into a role, becoming an otherworldly creature. Otherwise, his modified body is normal to him. comforting even. And over time, it becomes more and more aligned with the image in his head. Other studies, such as this 2014 article from the National Library of Medicine, show that people who suffer from BIID are found to have an increased tendency towards depression, and also some sort of issue with their parietal sensory S1 cortex. The S1 cortex, which normally gives a person body awareness, in the case of BIID, causes a person not to recognize a portion of their own bodies as their own, most commonly in their left arm. Perhaps this is the same psychological mechanism that causes someone to generate an entirely new body image modeled after an alien or Satan, or
perhaps it would be better to construct the ear on my arm.
You can always be like Australian artist Stellark, whose body image entails a third ear permanently grafted onto his forearm. The ear is constructed from his own living cells, an ear-shaped bioscaffold, and once implanted, receives blood supply from the local blood vessels on his forearm.
At first it was actually imaged as an ear on the side of my head, but surgically this was not a safe place.
I appreciate the fact that Stellark was open to the input of participating surgeons who feared paralyzing the right side of his face with the initial proposed location. When professional medical assistance is required in order to implement an extreme form of body modification, this is the type of collaboration I would like to see. Some flexibility on the part of the patient may be necessary to achieve a healthy result. Stellark's purpose is primarily artistic, stating that
this ear is for people in other places so they can remotely access what the ear is hearing here.
He plans to expand the design of his ear by separating the helix from the skin and growing an earlobe from his own stem cells. He will then implant a microphone and transmitter inside the ear so that it can pick up sounds around him and transmit them to listeners near and far. Because no, the ear is not capable of hearing on its own. Growing an ear-shaped appendage using sample cells from the extracellular matrix of the owner is totally possible. Replicating the inner ear's hearing apparatus and connecting it to the brain is another story. I wonder if he'll shut it off when he's on a date, or worse, using the bathroom.
The Queen has chosen our city to visit.
What troubles me more are body modifications that are undertaken before the person has had a chance to decide if it's something they want or not.
For centuries, the Padang women have carried the tribe's mark, the collar known as Wang.
For the women of Kaya and Lawi people in Myanmar and Thailand, this process must begin in childhood in order to achieve the desired effect.
Each of them began the painful process as a girl when her bones were small and flexible. She'll have to return every few years to have more coils added.
Unfortunately, this is a painful process that involves the gradual depression of the collarbone and rib cage below it.
When you wear the rings, it is not your neck that gets longer. It is your shoulders that gets pushed down and lowered.
And obviously, this can have an undesirable effect on overall health. With each added ring of brass, an axial load is placed on both sides of the collarbone. This depresses the connection between the collarbone, the clavicle, and the sternoclavicular joint.
The rib cage caves like a squeezed balloon, and the neck appears to rise higher from the collapsed collarbone.
The structures inside your thoracic cavity, the heart, lungs, great vessels, trachea, and essential nerves are vitally important and don't respond positively to constant depression. The fact that this body modification occurs gradually over a lifetime would mask any adverse symptoms such as difficulty breathing or reduced lung capacity, as they would manifest slowly over time and be difficult for the women to identify. As the collarbone and rib cage are depressed, the upper thoracic vertebrae would be pulled towards the neck. This would weaken the structural integrity of the spine to some degree, and I wouldn't be surprised if some of these women suffered from chronic neck or upper back pain.
You don't say!
A 2019 article in the Journal of Applied Physiology, Nutrition, and Metabolism showed several adverse factors in long-neck Kayan women versus a non-ring-wearing, similarly aged control from the same villages, including blood pressure, lung function, cerebral blood flow, endothelial and pulmonary functions. The study concluded brass neck coils worn by Kayan women may elevate risks of developing cardiopulmonary and cerebrovascular diseases. That doesn't sound too pleasant. It would seem that this practice dates back to the 11th century, when supposedly the men of the Padang tribe decided it was attractive for the women in the tribes to have brass coils around their necks, symbolizing purity and beauty. Over time, the tribe's women got used to wearing the rings, and some began to take pride in the custom. It makes me sad to think about the extent of pain they must have endured at the hands of their partners. I am thankful that in most cases, today the person whose body is being modified has chosen to undergo the procedure. Human Satan, or Michael Farrer de Frodo, has made this choice 60 times in order to become one of the most sinister looking humans alive.
Não foi algo que eu projetei. Diabo, esse daí é meu projeto e eu vou ser diabo, tá? Não era a ideia era o sinistro, né?
Unlike Anthony of the Black Alien Project, Michael doesn't have a specific body image that he's trying to attain. It sounds like his body image changes to accommodate whatever is the most sinister thing he can do. Like his alien counterpart, this has led him to surgical procedures. From fang and horn implants to tattooed eyeballs and a split tongue. He's also reduced his nose, removed a finger, and more recently removed his ears from the side of his head.
Is that your ear?
Yeah, from my head.
Generally speaking, I'd wager, these procedures appear more drastic than their actual effect on Michelle's function. The nose will still work, though the tip has been removed. The nasal passages and cavity humidify, warm, filter, and act as a conduit for inspired air, as well as protect the respiratory tract through the use of the mucociliary system. These spaces are much larger than they appear, and Michelle has left much of this intact. If I were to sacrifice one of my fingers, it would either be my pinky or pointer fingers. The thumb and the middle fingers are integral to normal function, holding and grasping. In the absence of the pointer finger, the middle finger will adapt to perform its function. Nothing can replace our opposable thumb, and elimination of the lesser fingers would cause a lot of difficulty holding things. Shopping bag or a hammer, for instance. As a surgeon, my fourth finger is quite important, as I use it frequently when holding and manipulating surgical instruments.
Michael Farrer de Frodo is a body modification enthusiast and reportedly wants to look as sinister as possible.
Without ears, Michelle will still be able to hear, but with more difficulty. The outer ear, or pinna, funnels sound into your ear canal, amplifying it. It also helps you determine where the sound is in relation to your head. As the shape of the ear influences sound waves differently depending on where they're coming from. You'll notice how things in front of you sound differently than those behind you.
How in the hell are you going to steal from an old woman?
If the pinna is gone, sound is diffused and it's harder to tell where it's coming from. It's likely the most difficult thing about all of these procedures is recurring infection and pain. Human Satan has said that some of the modifications hurt even more post-surgery than before surgery. He even said that the truth is that there are changes that without anesthesia would be almost impossible to be done. I concur. And yet, none of these factors have stopped Michelle from leading a regular life. Human Satan has a wife and a son, and they actually are in full support of his passion for body modifications. In fact, his wife shares his enthusiasm for body modification. Wherever they go, there are always people who are surprised to see them. Some are even eager to snap a pic for Instagram, while others look on with disdain. But with all the money spent and pain endured in pursuit of his sinister dream, I'm sure Michelle can handle a few haters. I hope you enjoyed the video. If you did, be sure to comment and subscribe. But if you didn't, be sure to comment why in the comment section down below. And as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.